name is Charlene. I'll be doing my physical assessment on Jasmine. Jasmine, you do have the right to refuse any part of this assessment, and this is confidential, and it will only be used for my classroom purposes, and only my instructor will see. We will start by looking at her face. I do see that her eyes are sitting symmetrical. Her nose is in the middle of her face. She's smiling, so hey, that's a good thing. Also, her smile is, and her expression is symmetrical also. Now I will palpate her scalp. I don't feel any lumps or nodules or anything. Now I will do her temples. And they are both soft. Now I will check her TMJ as she opens and closes her mouth to check for any clicks. No clicks or pops heard or felt. Now I want you to clench and hold your teeth. And that checks her cranial nerve 5. And now I'll check her sensory of the cranial nerve. Tell me if you feel this. Alright, that's symmetrical on both sides. Now we'll check cranial nerve 7. Can you smile for me? Frown. Lift your eyebrows up. Puff your cheeks out. And close your eyes tightly. Alright, good job. Now I will look at your eyes. I want you to cover your right eye. And I'm going to cover my opposite eye, and just tell me whenever my fingers come into your view, okay? You can just say now.
Now.
Okay. Do the other.
Now.
Good job. Now to check for, I'll hold the pen light in front of you and just follow, well, I hold my finger and just follow my finger. And she's doing good not to move her head. Her eyes are moving equally. Now just watch my finger still. Don't move your head. And her eyes do both go toward her nose. Now we will check her vision on the Snellen chart. If you will read the lowest line possible.
DEFPOTEC.
Okay, good job. That's 20/20 vision on the Snellen chart with glasses, corrected lenses. All right, now watch my fingers again. I'm gonna just move them and you just watch them. And that was checking her extraocular movement. She passed that. Her pupils are equal. I'm gonna use the pen light. Take your legs off, please. Her pupils are perla equal and reactive to light. I do see that her eyebrows are clean and free from any debris or redness or drainage. Her eyelids are also no edema, no redness or anything. Her eyelashes are beautiful. They're clean also, no problems there. Her eyeball is fine. I don't see any red streaks or anything there. Conjunctiva, sclera, cornea, and everything there is also fine. Now I will look at her ears. They are free from nodules, drainage. Now I will do the whisper test. I want you to put your hand over your ear, and I'm gonna stand behind you, and I will whisper 3 letters and 3 numbers, and I want you to repeat them, okay?
1, 2, 3, ABC.
Okay, the other ear, please.
XYZ 10, 11, 12.
Okay, she passed the whisper test. Now, I will inspect her nose. I see that there is no edema, no bruising or anything on the external part of her nose. If you would, hold one side of your nostril and sniff, and the other side. Okay, that all sounds clear. No stuffing is noted. Now, I will palpate her sinuses, and I will start with her maxillary. Take your glasses off, please. In the frontals. No swelling or tenderness noted. Now I will look at her mouth and throat. I'm gonna use my pen light to look down your throat and look at your teeth, okay? Okay. Look, say ah. Which side? Her uvula does vibrate. Her teeth are intact. Gums are pink. Mucosa is moist. Her tonsils are normal. Stick out your tongue for me. Okay, and that it does show some symmetry. Now I will look at her neck and palpate her lymph nodes. Put your hair behind you for me. She does have some tenderness noted there, but I believe she is on antibiotics for upper respiratory infection right now. Now let's check cranial nerve 11. We're going to do chin to chest. Okay. Turn your head side to side. Good. Ear to shoulder. And extend your neck backwards. And then also turn your head to each shoulder and bring your shoulder up to your ear. Okay. And that was checking the strength. Now I will palpate her trachea. I see that it is midline. Can you swallow for me? Okay. And I didn't see that it shifted either way when she swallowed. Now I will palpate her carotid pulse. And it is equal on both sides. Now I will palpate her thyroid. She does have a glass of some water here, so I'll let her take a sip. If you'll hold on 1 second. All right, tilt your head over to the side just a little. It doesn't matter which side. Okay, now you can drink. Okay. All right, and that felt soft and spongy, nothing abnormal noted there. Now I will inspect her posterior chest. Put your hair around to the side. All right, I want you to say ah, ah, ah. All right, I did feel minimal vibrating there. Her posterior chest is symmetrical. It is even on both sides, and that's a good thing. Now I will palpate to, well, that was palpating to detect tactile firmitis there. The symmetry, like I said, is equal when she breathes. Now I will percuss her lung fields. And that sounds good also in all fields. Now I will auscultate her breath sounds posterior. Big breath. And everything was clear and equal. Now I will assess your upper extremities, which will be your arms. Hold your arms out. I'm gonna look at them. I don't see any bruising, any swelling. The skin tone is normal on both sides. You can relax them. I'm gonna check your capillary refill. It is less than 3 seconds bilaterally. Now I will check her pulses. We'll start with her radial. They're equal. Her ulnar pulses. They are also faint but equal. And now I will check her brachial. They're also equal and faint bilaterally also. Now we will do range of motion. Flex your arms over your head, please. Okay. Now let's do them behind your back. Let's just out and then adduct them. Thank you. Now we will do your elbows. So this flex and extend. Well, that's your wrist, I'm sorry. Flex and extend. Do your fingers in and out. And then do the thumb to each finger test. Thank you. That's all equal on both sides. Now we'll do the elbows. So we're gonna pronate and then supinate. And then I'm gonna push down as you push up, okay? Just test your strength. Okay, do the opposite. You push down, right? Strength is equal in both sides. Now I will check her cerebellar function. I want you to put your arms out, close your eyes, and bring your pointer finger to your nose. Okay. Good job. All right, now close your eyes and I want you to take your pointer finger and touch my pointer finger. Okay?
I'm doing it on this end.
Yes. Good job. Now I will test her gravesthesia and stereogenesis. Gravesthesia, what I'm going to do is write a letter in your palm, okay? And you just tell me what it is. Okay?
C.
Good job. Now close your eyes and I'm going to put an object in your hand and you tell me what it is. And this is the stereogenesis.
So paper.
Okay. Hold the other hand.
So coin.
Okay. Good. It's actually a dime, so she was correct. Now I will inspect her anterior chest. I'm gonna let you lay down. I see that her chest is symmetrical. She's not having any problems breathing. Her breathing actually looks like it's even and unlabored. Now I will inspect her precordium for pulsations. Which I don't feel any abnormalities there. Now I will listen to her breathe. My stethoscope does not have the bell-end diaphragm, so I'll only be listening with one side. She is clear bilaterally. Now I will look at her abdomen. Her skin is not discolored. I don't see any swelling, any birthmarks, any bruising or anything. The symmetry is even. Her umbilicus is inverted as it should be. Now I will listen to her abdomen and all 4 quads. Her bowel sounds are hyperactive in bilateral lower quads and hypoactive in bilateral upper quads. Now I will listen to the aorta and bilateral renal arteries. This is the aorta. And these 2 are the renal arteries. No swooshing or anything was heard there. Now I will percuss all 4 quads in a clockwise motion. No, percuss I'm going to do in an up and down motion, I'm sorry. No different sounds heard in any certain area. It all sounded the same. Now I would lightly palpate in a clockwise motion using just the tips of my fingers. Now I will start to deeply palpate. And I'm supposed to feel for the liver on the right side. I don't feel anything that feels different on this right side, so I'm going to say that the liver is where it should be. Now your lower extremities, I'm going to look at her legs. She does have vitiligo, so there is some skin discoloration there bilaterally. I will palpate her popliteal pulse. Hers is good. And this one? The easiest one I've ever found. Now I will do her posterior tibia pulses. Cold feet. And they are equal bilaterally. And now the dorsalis pedis pulses. And she's already plantar flexing her feet. Can you dorsiflex them? Good job. Invert and evert. Okay. Now let's check your range of motion in your hips. Bring your knee up to your chest. Okay. And then turn it out. Turn your hip out. Yeah. Do the other one the same way. And then turn it out. Good job. All right. Now I'm gonna push against your feet, and I'll kind of like we did your arms. Okay. And the opposite. Good job. Good strength on both sides. Now I will check your reflexes. I just lost my whole train of thought. My whole train of thought. Okay, sit on the side of the bed for me. Patellar reflex. Good job. It's not the Babinski, which one? Our Achilles reflex. And then now the Babinski. Her big toe did go up. Alright, now if you would stand up. And I need you to you can actually walk to the camera where you get her feet when she walks. Walk on your heels, please. On your heels. You want your shoe? Alright, you can walk on your heels. Okay, and then turn around and walk back on your toes. Okay, now stand there for me. And if you would, put your legs together, eyes closed, and just stand. And this is checking the Romberg. Just minimal swaying is noted there. Now I want you to hop on one leg. Okay, hop on the other one. Good job. Now when you bend over, I'm going to inspect your spine. I don't see any curvature or anything in it. You can stand up. Now will you bend sideways, both sides, and then backwards, and then twist your shoulders from side to side. All right, that's the end of my physical assessment. Thank you and have a great day.